So, continuing with the opioids, there is clinical uses. These are actually used as analgesic agents, but there's a there's a twist to it, like visceral, dull, and constant pain, like muscular pain or visceral pains. They're all relieved, but uh, but if there is inflammatory pain due to an abscess, due to inflammation, that is not effective. वहाँ पे effective नहीं होता है ये opioids. No, opioids are however contraindicated in biliary colic because they increase the intrabiliary pressure, वो increase कर देते हैं, तो इसकी वजह से they are contraindicated in biliary colic. Now, morphine is useful in the myocardial infarction as well as acute pulmonary edema. Acute pulmonary edema. Codeine, folcodeine, and dextromethorphan and noscapine, they're all एंटीटसिव्स ऑल्सो हमने उसमें पढ़ा था रेस्पिरेटरी में कफ सप्रेसेंट्स होते हैं ये सब and dextromethorphan is devoid of constipating action unlike other drugs तो उसमें actually constipation भी होता है constipation is a side effect of all of these drugs I was having so dextromethorphan is devoid of constipation इसका side effects जो होता है dextromethorphan is devoid of those side effects loperamide is for obviously diarrhea and diphenoxylate they use for the non-infective diarrhea मतलब इन्फेक्शन नहीं है तब डायरिया हो रहा है because of the derangement in the fluid concentration or because of any other reasons तब हम लोप्रामाइड देते हैं डाइफेनॉक्सिलेट देते हैं बट अदरवाइज हमें वो देना पड़ेगा एंटीबायोटिक्स देनी पड़ेंगे मॉर्फिन इज यूजफुल एज अ प्री एनेस्थेटिक मेडिकेशन whereas highly lipid soluble drugs like fentanyl, morphine तो है pre-anesthetic agent, but fentanyl, afentanyl, sulfentanyl, no? These are the drugs used as adjuncts to other anesthetic agents. तो ये हमने fentanyl वगैरह पढ़ा भी हुआ है कि it is used as anesthetic agent general anesthesia में. Now betadine it reduces the shivering after anesthesia by its action on the alpha 2. तो इसका एक्शन कहाँ हो रहा है अल्फा 2 रिसेप्टर्स पे हो रहा है now routes of the administration morphine can be administered oral rectal IV IM and intrathecal epidural routes सारे ही routes use होते हैं intrathecal दिया हुआ है fentanyl can be applied as transdermal patches or can be administered by buccal transmucosal route and butorphanol is the only opioid available in nasal formulation तो butorphanol एडवर्स इफेक्ट्स क्या क्या हो सकते हैं इसके respiratory depression obviously nausea vomiting constipation and urinary retention तो हमने पढ़ा ही था itching and dysphoria भी होते हैं itching ये हमने उसमें पढ़ा था anti depressant में पढ़ा था although but opioids हैं we just started opioids right yes yes इसमें ड्रग्स भी नहीं दिए हैं fentanyl वगैरह नहीं दिए हैं कैम्प्रोसेट किस लिए था it was for abstinence maintenance के लिए था drugs नहीं दिए okay itching and dysphoria there are the major adverse effects of the opioid tolerance obviously develops except meiosis तीन था ना वो constriction of the eyes तो meiosis. 3 C's tolerance develop होती है, constipation and convulsion. इसमें tolerance नहीं develop होता. And opioids, that are highly addictive substances and can lead to development of psychological as well as physical dependence. Sudden discontinuation of these drugs in a dependent subject may lead to withdrawal syndromes such as rhinorrhea, lacrimation, yawning, chills, mydriasis, vomiting, diarrhea, and anxiety. Most of these symptoms are opposite to the normal action. जितना भी action होता है, like diarrhea नहीं, constipation होता है because of the codeine, folcodeine, dextromethorphan, उसकी वजह से तो constipation ही होता है. Although dextromethorphan is devoid of the constipation पेट्री जो उसका साइड इफेक्ट्स होते हैं, डेक्स्ट्रोमेथॉर्फिन से नहीं होता है वो. बट बट सब कुछ ऑपोजिट होता है. if we have stopped abruptly opioid, if a patient has stopped the opioid intake abruptly तो ये सब कुछ होएगा. Yawning, chills, mydriasis, vomiting, diarrhea and anxiety. Most of the ये तो हमने पढ़ ही लिया. Contraindication and precautions. Now, morphine is absolutely contraindicated in head injury. Absolutely contraindicated in the head injury because it increases हाँ तो ये intracranial pressure वगैरह tension intrabiliary में biliary colic में भी contraindicated होती है, head injury में भी, because it will increase the intracranial pressure and causes retention of the CO2. CO2 का रिटेंशन होगा ड्यू टू रेस्पिरेटरी डिप्रेशन भी हो गया है उसके साथ साथ. It also interferes with the assessment of neurological function by masking the important pupillary signs because meiosis करवा रहा है तो हम neurologically हम find out ही नहीं कर पाएंगे कि if the patient is like if the patient is responsive or not because he already pupil को meiosis करवा रहा है तो it will be masked. तो हम morphine that's why हम नहीं देते हैं in head injury. And these drugs should be used cautiously in patients with pulmonary, hepatic, and renal dysfunctions because यहीं से इनका excretion भी होना है. Use of the opioid in infants and elderly also require caution. Patient of hypothyroidism may show exaggerated response to the obviously. I think I read somewhere कि hypothyroidism करवाता है. Let me just no कहाँ पढ़ा मैंने फिर. लिथियम करवाता है. It's an anti-maniac drug. Hypothyroidism, हाँ, sorry. Lithium कराता है hypothyroidism also. Um, Prolonged use of the opioid in pregnancy may lead to in utero physical dependence of the fetus. Fetus को भी dependency हो सकती है and severe withdrawal symptoms may be precipitated after birth. तो अगर birth हो गया तो उसको भी diarrhea और rhinorrhea and constipation और sorry diarrhea और है ना constipation तो होएगा ही नहीं. Yawning, chills and mydriasis, vomiting, diarrhea वगैरह, anxiety वगैरह ये सब होएगा अगर डिपेंडेंसी हो गई है फीटस को तो उसमें भी विड्रॉल सिम्टम्स देखने को मिल सकते हैं. हाइपोथायराइडिज्म या दिस विल एग्जैजरेट तो हम इसको मार्क कर लेते हैं. हाइपोथायराइडिज्म में नहीं देना है, exaggerated response आएगा because important points about the specific. Now morphine, hydromorphine, morphone, oxymorphone. They're strong opioid agonist, useful as analgesics, obviously. Heroin, which is diacetyl, हाँ इसका acetylation होता है ना जो morphine का तो heroin बनता है. So it's a potent and fast acting opioid but carries high risk of abuse potential. And methadone ये भी हम pain के लिए use करते हैं. Oral, IVSC and rectal routes से दे सकते हैं. Apart from potent agonist action at mu receptor पे इसका agonist action होता है. It also blocks the NMDA receptors and reuptake of monoamines. तो ये Methadone is the one. Reuptake भी inhibit करता है. These properties explain its ability to relieve neuropathic and cancer patients. तो NMDA भी block कर रहा है. It has agonist action with the mu, तो analgesia भी produce कर रहा है. And reuptake भी block कर रहा है. तो neuropathic and cancer patients that are not controlled on morphine due to its long T-half development of the dependence and tolerance is very slow. तो बहुत ज़्यादा T-half है, that's why dependency नहीं होती है, इसकी tolerance भी बहुत slow होती है, making it useful for treatment of opioid abuse. It is also useful for opioid rotation therapy due to its long T-half and development of very slow. Hmm. Now, pethidine and pentazocine, they possess anticholinergic activity. ठीक है? And can result in tachycardia. These are the drugs contraindicated in MI, obviously, because इसका excitatory activity होता है MI में. Already, like blocked है heart के arteries. तो अगर excitatory activity हुआ, तो it will precipitate the MI. Because of the anticholinergic property, these are relatively safer in the biliary colic also. The opioids, however, they are not given because वो intrabiliary pressure increase करता है. Because it has anticholinergic property, so it won't do that. It won't increase the intrabiliary pressure, and it is safe. It is safer, right? Relatively safer. It's not given, but it's relatively safer as compared to other agents. Accumulation of active metabolites जो हैं norepinephrine, these can produce seizure. ये तो तीसरी बार आ रहा है पॉइंट. जो इसका एक्टिव मेटाबोलाइट है वो सीजर कॉज करवाता है. Levorphenol is similar to morphine in its action. Propoxyphene is the least potent and least efficacious. Paroxyphene. Diphenoxylate and its active metabolite, diphenoxin as well as loperamide, they are useful for diphenoxylate and loperamide. These are the two drugs that are good with the diarrhea. भी दिया हुआ है ना ऊपर, भी दिया हुआ था loperamide and diphenoxylate. Buprenorphine exhibit ceiling effect due to its respiratory depressant action. What's a ceiling effect? गूगल भी नहीं चल रहा तो. Buprenorphine again dissociates slowly from SAS to be mu. Mu receptor and is resistant to naloxone reversal. So naloxone was a drug that was given in opioid toxicity, है ना? Yeah, the adverse effect of the toxicity, the contraindication, clinical, mixed antagonist, peripheral, pure opioids, naloxone. मिलेगा अगर मैं ढूंढूंगी तो. naloxone लिखा तो था कहीं पे कि टॉक्सिसिटी में हेल्प करेगा. लेट मी सर्च. मॉर्फिन पॉइजनिंग थियोसिस naloxone. क्या treatment or atropine naloxone again useful for gout. naloxone उसका आंसर थोड़ी ना naloxone. इसका भी आंसर थोड़ी ना नालोक्सान। सॉरी। हाँ, इसो रिवर्सल, ओके। ओके देन इसमें नहीं है। मैंने कहीं तो पढ़ा था बट इसमें नहीं पढ़ा था। ओके 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 फाइन। तो एक्चुअली नालोक्सान देते हैं ऑल्दो मॉर्फिन पॉइजनिंग में। Butorphanol, pentazocine, and dazocine. Butorphanol, pentazocine, and dazocine. They possess the psychomimetic, so that they have to be acting on the kappa agonistic activity होनी चाहिए हाँ. Ziconotide is approved for intrathecal analgesia. Ziconotide. It acts by blocking voltage gated N type calcium channel. N type calcium. Tramadol is a weak mu receptor. Tramadol देते हैं. Weak mu receptor agonist होता है. It inhibits reuptake of sodium, again sodium, Na, noradrenaline, and 5-HT, which is serotonin. These effects are responsible for its analgesic action, which can be abolished by 5-HT3 antagonists like ondansetron. तो 5-HT3 का antagonist है ये. At high doses it can lead to seizure. तो इसमें बोल रहे हैं what are they saying actually कि वीक म्यू रिसेप्टर एगोनिस्ट है एनालिसिस से करवाएगा एंड इट आल्सो इनहिबिट्स द रीअपटेक. मतलब जो टीसीएस एसआरआई एसएनआरआई करा रहा था दे विल आल्सो इनहिबिट द रीअपटेक ऑफ एनएन 5ht. These effects are responsible for the analgesic actions, okay, which can be abolished by 5ht. ठीक है. अगर हमने ट्रामाडोल दिया तो ऑन्डासेट्रॉन नहीं दे सकते बिकॉज ये इसका एक्शन इनहिबिट कर देगा बिकॉज यहाँ पे तो एंटागोनिस्ट ही है 5ht3 एंटागोनिस्ट है और ये एगोनिस्ट दे आर टेकिंग रीअपटेक टू दिस इज एगोनिस्टिक म्यू रिसेप्टर एगोनिस्ट है ये. तो ऑन्डासेट्रॉन के साथ हम ट्रामाडोल नहीं देते हैं. फाइन. tapentadol tapentadol is a new analgesic with mu receptor agonistic action and Na reuptake inhibition action. So this doesn't let the Na be reuptaken. Same as tramadol. Iluxidolin is a mu agonist and delta receptor antagonist. तो डेल्टा रिसेप्टर एक्चुअली करवा के रहा था. इट वाज वही 5ht और Na का करवा रहा था रीअपटेक ना. स्पाइनल एल्जेसिया ठीक है. मॉड्यूलेशन ऑफ द हार्मोन द एंड सॉरी न्यूरोट्रांसमीटर रिलीज. तो मॉड्यूलेशन हो रहा था वहाँ पे. तो it is approved for oral treatment of diarrhea. Flog, floxa, sorry, iloxadoline dominant. डायरिया डोमिनेंट. अगर आईबीएस है किसी को, आईबीएस है इरिटेबल बाउल सिंड्रोम डोमिनेंट है डायरिया भी हो रहा है तो हम वो दे सकते हैं इलोक्साडोलिन. Opioid antagonists naloxone, naltrexone and nalmefene are potent mu. I don't know क्या है but mu होना चाहिए. Antagonist blocking, also blocking of the kappa and delta receptors. Albumopan and methyl naltrexone और peripheral opioid antagonist यहाँ पे था. ये opioid antagonist हैं सारे, naloxone, naltrexone. That's why it's given parenterally. It's ineffective orally. तो हम parenterally ही देते हैं क्योंकि ineffective होती है orally, and it's a very short acting drug. Nalmefene is actually given parenterally but has a longer half life. Naltrexone is long acting orally effective opioid. तो action क्या है? These have no action in the absence of agonists. It promptly reverses the opioid effects when administered IV. तो opioid का effects जो होता है reverse कर देते हैं. They don't have like मतलब कोई action नहीं होगा अगर हमने कोई opioid नहीं दिया है. They will have no action. But अगर हम opioids IV दे रहे हैं तो और हम ये सब भी दे रहे हैं, opioid antagonist भी दे रहे हैं, naloxone, naltrexone, nalmefene ये दे रहे हैं हम IV, so it will reverse the opioid effects and they can also precipitate withdrawal syndromes. तो जैसे हमने opioids किसी ने टेक कर रखा है and then we have given these opioid antagonists, these can precipitate the withdrawal symptoms in opioid dependent patients or subjects. Uses क्या है? Naloxone is a drug of choice for acute opioid poisoning. Acute अगर opioid poisoning है तो हम दे सकते हैं, drug of choice है. But it has to be repeated frequently because short acting है ना. Because it's a very short acting. It's not just short acting, it's very short acting. So it should be repeated frequently. Naltrexone is used as a maintenance drug for opioid poisoning. ये तो हम initial देते हैं. ये मेंटेनेंस के लिए दे रहे हैं. It is also used to prevent the relapse after the opioid de-addiction. तो डी एडिक्शन हो गया ओपियोइड का. if the subject is again going for the opioid, he starting the abuse, तो हम naltrexone दे सकते हैं to maintain the drug, to to prevent the relapse. And it is also used to decrease the craving in chronic alcoholics. Naltrexone. तो उप्स naltrexone देते हैं हम to decrease craving in chronic alcoholics. Naltrexone plus bupropion has recently been approved for treatment of obesity. Oh my god. Naltrexone and bupropion for obesity. I am not sure यहाँ पे ये मैंने कहाँ पढ़ा था, but I think ये हमने वहाँ पे पढ़ा था anti manic drugs में, anti psychotic. Let me see. Bupropion ये रहा, increases presynaptic release of the acetylcholine. Atypical में है ना, typical. Inhibits the reuptake because it is presynaptic release of the catecholamines. करवाता है. It metabolizes to amphetamine-like compound and possesses excitatory property. Smoking cessation में help करता है and can cause seizures at high doses. खतरनाक drug है, but it can be used to control the weight loss. I mean, obesity as well. Right? तो bupropion क्या करवाता है? इसका excitatory activity होता है. It can smoking cessation में help करता है bupropion, and also smoking cessation and कहाँ गए थे आप? लेके भी आ गए. Naloxone is actually neonatal resuscitation में use होता है to reverse the effects of the opioid if used during labor. अगर लेबर में हम यूज कर रहे हैं ओपियोइड्स तो हम नियोनेटल रिससिटेशन में naloxone दे सकते हैं. However, it should not be used for this purpose if the mother is dependent on the opioids. Because then baby will also be dependent in utero and naloxone can precipitate the withdrawal. तो हम तब नहीं देते हैं. Naloxone is being added to opioid means meant for oral use to minimize their addictive potential. The patient takes the combination orally. Only opioid is absorbed, not naloxone. तो orally अगर लिया तो only opioid is absorbed, naloxone नहीं होता. Thus it will produce the desired action. However, if the person takes it by IV route and naloxone also reaches the blood and stops the euphoria. I don't get that. तो orally क्यों देना है? No methyl naproxen, nalmefene, and naloxone, the peripheral opioid antagonist indicated for opioid-induced constipation. अगर constipation हो रहा है तो methyl naltrexone, nalmefene, and naloxone ये सब दे सकते हैं. Albumin is another peripheral receptor antagonist used for post-operative ileus. Albumin. Now uses of the opioid antagonist. Naloxone for acute opioid poisoning, for neonatal resuscitation. तब नहीं देते when mother is dependent because then fetus will also be dependent on it. और naloxone देने से then withdrawal symptoms precipitate हो जाएंगे. And also with opioids. Orally दे सकते हैं to minimize their addictive property. Naltrexone to maintain, it's a maintaining drug for the opioid poisoning to prevent relapse in opioid de-addiction and to decrease craving में alcohol. अभी के लिए इतना ही.